Hello and Happy New Year. Welcome to our first webinar of 2023 with eLotus, your leading provider of acupuncture and continuing education. I hope you guys all had a wonderful holiday season and you're ready to get your learning on to help more people with TCM. My name is Donna Chow and I'll be hosting and moderating today's webinar. Please note this webinar does not include CEUs and is for educational purposes only. Today's 1-hour webinar is COVID-19 and TCM, past, present, and future, presented by Dr. John Chen, who is a recognized authority in both Western pharmacology and Chinese herbal medicine. He is the leading author for the Chinese medical herbology and pharmacology, Chinese herbal formulas and applications, and Chinese herbal formulas for veterinarians books. More information about these herbal books and the herbs that Dr. Chen will be talking in the class can be found in his books, which can be purchased at evherbs.com. To find past COVID-19 webinars presented by Dr. Chen and other COVID-19 literature, please visit eLotus.org to access our COVID-19 resource page, found under our free stuff section. In this course, you'll learn the advantages and disadvantages of using Chinese herbs to prevent, treat, and recover from COVID-19. The goal of this course is to learn from our misjudgments and remember our successes in order to continue to improve in the future. Okay, let's go ahead and begin and welcome Dr. Chen.
Share audio and video too.
Yeah, you already did.
Okay. Let me do a quick audio and video testing. So the audience, if you can hear me and see me, please type in the chat so Donna can give me a thumb up to proceed. All right, looks like we're ready to go. All right, Happy New Year, everyone. And thank you again for joining us for our first webinar of the year. My topic today is COVID-19, past, present, and future. And what I'm hoping to do with today's class is to wrap up and maybe give an overview of what we have all gone through in the last 3 years. Basically, the first half an hour or so will be a lot of reviews for material that I have presented in the last 3 years. And I think this is helpful to put everything in context before we wrap up on this topic. And also, for those of you who have not heard or seen all the material that Lotus has put together for the last 3 years, this hopefully will give you some idea of what you missed. And if you wanted to, obviously go back and revisit some of these materials. All right, so these are some of the topics that I have done with Lotus Institute. Basically on number one, how coronavirus, COVID-19 is treated with TCM in China. So this is one of the first webinars that we did. And the next one is how COVID-19 and TCM, what are the scientific research and clinical evidence of Chinese herbs? Okay, so both of these are regarding TCM and how they can be used to prevent and treat COVID-19. And as far as how to think about past, present, and future, roughly you can think about the past as the old school TCM principles and paradigms, how they are used to treat various infectious disease. And obviously the two guiding principles are Sanghan, which is cold-induced damage, and Wenbing, which is warm diseases. And I think in this case, both of them play a significant role in viewing COVID-19, how to prevent and how to treat. And the present is how the Western medicine and Chinese medicine are integrated together. Because what happened is, coronavirus is a novel virus. At least this strain is different. So what happened is usually at the beginning of the pandemic like this, even though we can claim that Chinese medicine has thousands of years of experience, nonetheless, some trial and error is necessary in order to find the best pattern diagnosis and as well as the best formula. And then on top of that, Western medicine is also very beneficial because it's very helpful with diagnosis. Also, a lot of research have been done to show which formula is most effective, which single herb is most effective. And in fact, going into the molecular components of the single herb and exactly how they work to block the transmission, the entry, the multiplication of the virus. Okay, so even though we are TCM practitioners, I think it's very good for us to learn about Western medicine, about pharmacology, and so on. The more you can learn about different modality of medicine, the better we can help the patients. Okay, and then finally, we'll talk about the future, and that is as COVID-19 slowly winds down, we see less and less of the COVID patients, but perhaps more and more patients that suffer from long COVID. So we'll talk about long COVID and treatment of long COVID. And also, most people probably have gotten COVID vaccine. So we'll talk about some of the more common COVID vaccine toxicities and what are the things that we can do to help to alleviate those problems. So that will be our goal for today's 1 hour class. All right. So as far as long COVID is concerned, what happened is Western medicine for the longest time denying long COVID. And the reason is because they see COVID-19 as an infectious disease. And once the virus is gone, once the test shows negative, generally speaking, as far as they are concerned, that's the end, that's it. Okay, but what I didn't realize is even though the infection is gone, there's a lot of sequelae, there's a lot of complications that are left behind. So the patients were the one that actively show the community, the medical community, that they in fact have complications, that their health is no longer the same, even though the disease is gone. And from there, Western medicine begin to take long COVID more seriously. All right. This here is a quick graph that shows the signs and symptoms of patients that suffer from acute COVID versus the post-COVID or the long COVID signs and symptoms. So a lot of the overlapping signs and symptoms, but the severity and frequency are a little bit different. Okay, but generally speaking, what happened is a lot of these signs and symptoms are somewhat vague and non-diagnostic. So you really have to look at the entire picture in order to come to a conclusion of what the patient may be showing. So basically the big picture is what their condition was before, what their COVID-19 infection was like. Was it mild, moderate, or severe? And then as they get over the infection, what are some of the signs and symptoms that linger or that last behind? Okay, so quick wrap up on COVID-19 is that this is a disease, this is an infection that primarily enter the body through the lung and also through the digestive tract. So lung and spleen, lung and stomach, intestines are the first organs that suffer from damage as a result of COVID-19. And then what happened is this is the point of entry, but that's not the end. The virus can then grow and proliferate and affect many other parts of the body. Okay, so for a patient that had mild to moderate COVID-19, it may end with a few days of influenza or cold-like signs and symptoms. But for those that have a very more severe condition, COVID-19 may affect the cardiovascular system, endocrine system, skin, liver, kidney, and so on and so forth. So generally speaking, the more acute, the more serious the COVID-19, the more likely the patient will have some type of long COVID signs and symptoms. All right. And once again, to sum up, this is a great article that look at the whole thing. The article is called Therapeutic Options of TCM for Organ Injury Associated with COVID-19 and the Underlying Mechanism. And basically, the article breaks down COVID-19 to three main parts. The first one is the direct cytotoxic effect. And what that is as the virus enters the body, it goes into the lung cells, it grows, multiplies, and eventually kills the lung cell as it causes the lung cell to burst and then the virus is disseminated to other parts of the body. So this is a direct cytotoxic effect where the virus damages the lung cell and the lung directly. Okay, and then as the virus begin to multiply and affect different parts of the body, the immune system kicks in. Okay, where there is dilation, the white blood cells, the immune cells go from the blood to the lung to take care of the virus. And sometimes it does it appropriately. Other times the immune system becomes dysfunctional, becomes hyperactive, and that may then lead to cytokine storm and all kinds of inflammatory reactions. Okay, so in a way, this is the immune system becoming too hyperactive and over response, basically. So while that may be good in moderate cases to treat the virus, to treat the infection, but excessive response by the immune system can cause a lot of damage on their own. Okay, and that's why a lot of patients end up with various degrees of damage in lung and many other organs in the body as a result of dysregulation of the immune system. Okay, and finally, is the sequelae. You know, once the virus is gone, once the test shows negative, but what happened is during the inflammatory process, the excess heat, the excess immune system attack cause a lot of damage to multiple tissues and organs in the body. And this is called the apoptosis or injuries. Okay, so from a TCM perspective, the first and second stage are basically heat. Okay, one is heat caused by the virus, caused by the infection. Two is heat caused by the immune system. And this is basically, you know, heat and fire throughout the body. And as we learn, that heat and fire, if persistent in the body for an extended period of time, will damage yin and will damage qi. All right. So in this case, what happened is the cytotoxic effect and the inflammation from the immune system is the heat. And as it damaged the yin, that means it damaged the underlying organ of the body. All right. So if you think about the lung cells and the lung membranes and so on, those are organs, those are the yin aspect of the body. So that part gets damaged through the inflammation, through the virus. And then what happened is, as the organ is damaged, it is less able to perform its function. And the function in this case is the qi, right? So excessive damage by the virus and by the immune system translates to damage of the organ and the subsequent function. So these are the three main things to consider as you look at the big picture, the big picture of the infection, the inflammation, and also the complication. And therefore, as you consider how to treat these patients, well, when the patient still had the infection, you need to treat the disease, right? So once again, depending on where the virus is, if it's affecting the lung, it's primarily lung heat. If it's entering the body through the intestines, through the digestive tract, then it's probably heat in the stomach and the intestines. And if it moves on to other organs, then it's heat, you know, in other organs. Okay. And then as the immune system kicks in, if it becomes hyperactive and dysregulated, then that is also considered heat and fire, but not so much a localized heat and fire, but more of a systemic heat and fire. Okay, so where the infection aspect of the heat is generally more localized. So perhaps it's more of a damp heat type of characteristic. But once it becomes a systemic dysregulation of the inflammation system, it's more like a heat and fire all throughout the body, maybe upper jiao, middle jiao, lower jiao, or perhaps all three. Okay, so the TCM perspective is a little bit different, even though they are all under the category of heat. And then lastly, as the infection and inflammation damage many different parts of the body, this is yin deficiency and qi deficiency or qi damage. So as we wrap up on treating these patients, we can use a general approach, which is more or less to treat the disease itself. Or we can use a more specific approach, which is to treat the patient that has the disease. Because while most patients have some overlapping signs and symptoms in common, they are those that show more specific signs and symptoms. So we have to take those into consideration. And then, of course, TCM has many modalities and many tools. In addition to Chinese herbs, you can also use acupuncture, massage, and different exercises. And they are all important for the complete recovery of the person. All right. So once again, we'll go through all these relatively quickly. And because I have already discussed these in many other webinars. All right. So once again, it's a 1 hour class. It's not too long. So if the beginning is a little bit of a review, please bear with me. I promise the last part of the class will be worth it. All right. Anyhow, to continue, as we think about how to treat the infection itself, as we mentioned, these are basically heat conditions. So we primarily use heat-clearing herbs to treat these infections. And for those of you who are interested in pharmacology, there are many, many herbs that are in the heat-clearing category. Some are, in fact, specifically for treating viral infection. All right. So as you pick a herbal formula, or as you modify a classic herbal formula to add in specific herbs, I would definitely keep this in mind because these are the herbs that have direct antiviral effect to block the entrance of the virus to the cell and also to block the replication of the cells. Okay, so that makes the treatment that much more specific and that much more effective. So, here's a list of herbs. You can read it on your own. And for your information, of course, as you, quickly skim through this list, most of these are going to be heat-clearing herbs. Okay, so that's self-evident. And most of them you should know, but there are probably some that you don't know or may not even expect. Such as toward the bottom of the list, you have an herb called Xiang Chun Ye, and that is in fact a very good antiviral herb. Okay, most of the practitioners don't know about this herb, and in fact, we don't usually teach this herb in school. That's probably why. But a lot of research have been done, and it shows that this herb is quite effective, specifically against coronavirus. And also, you have some herbs like Wu Beizi, which is Gala chinensis. It's an astringent herb that you wouldn't think could be used to treat infection. But in fact, what happened is it does bind to the virus and block its entrance into the cell. Okay, so they all have different mechanism of action, okay, and it's quite interesting, all right? And if the patient has the infection already and the body is over-responding and become dysregulated, then what happened is the body basically is producing too much of pro-inflammatory factors that leads to excessive inflammation. And once again, these inflammations are good in the beginning, but if getting out of control, then most likely they'll cause more harm than good. So these pro-inflammatory factors are interleukins, interferons, and tumor necrosis factors, and so on. Okay, and once again, inflammation is a heat condition. So to counter the heat condition, heat-clearing herbs can be used. Okay, so some examples are Da Huang, rhubarb, Huangqin, Scutellaria, Guanghuoxiang, Pocostemon, Dansen, Salvia, Sisgao, gypsum, and so on. So once again, most of these are heat-clearing herb, but some of them, like Dansen, Salvia, is a blood-moving herb. Okay, so keep in mind that all the herbs basically most of the herbs have more than one function. There's primary function, secondary function, and sometimes tertiary or functions or more. All right. So Dansen is one of those that is primarily used as a blood-moving herb, but it in fact have many other uses, and to reduce inflammation is in fact one of the benefits. Okay, and lastly, as the patient eventually got rid of the virus, so now the infection is negative, infection subsides. Now what happened is we have to deal with the aftermath. Okay, the aftermath of organs and tissues being damaged. In fact, in this case, we literally mean damage. So when the patient said their lung is scarred, okay, so basically it's been damaged. And if you say scar, perhaps there's even blood stasis or scar tissues. Then what we need to do is we need to nourish in to restore the organ itself. We need to tonify qi to improve the organ function. And if there is scarring, that usually means there's fibrosis. And that in turn in TCM is blood stasis. So that means we also have to use some blood-moving herbs. So depending on what the TCM diagnosis is, you need to select and use herbs accordingly. But in this case, if you are just thinking in a term of apoptosis, apoptosis is the death of the cells or the tissues. That generally means damage to the structures or organs of the body. So these herbs are mostly going to be herbs that nourish in and nourish fluids. Okay, so you have枸杞子, lycium, 红景天, rhodiola, some chitonic herb, Huangqin, huangqi, not huangqin, and huangqin too, a little bit later. And also, interestingly, some heat clearing herbs like da huang, rhubarb, sanqi, noto ginseng, and so on. So once again, it's not just in tonic herb does this, but other herbs don't do that. Keep in mind that many herbs have secondary and tertiary functions. And once again, if you are able to study the pharmacology of the herbs, it will help you to learn new functions of the herbs that you may not have already known. Okay, so as we dive in to how to best treat long COVID, remember that TCM is a very complete medicine. So in the earlier parts of 2020 and 2021, we talked about many state protocols, provincial protocol, and national protocol for treating COVID-19. It's not just treatment that's generally discussed, but rather there's prevention, there's treatment, and there's also recovery. All right, so recovery is one of the three triangles that is very important to treat the entire person from the beginning to the end. Okay, and what happened is all three of these regional, provincial, and national protocol all agree is that during the recovery phase, the main thing to focus on are lung and spleen. So basically the points of entry in the lung and also the spleen, digestive system. And also things that are most likely damaged during COVID-19 infection is qi and yin. And once again, yin referring to the organ, qi referring to the function. So in most cases, if you are able to focus on the qi and yin deficiency of the lung and spleen, you will be heading the right direction. Okay, so for most patients, this is what they need. And obviously, toward later on, we will discuss something more specific because not everybody shows the exact same thing. Some, you're going to have some people that show things that are a little bit different. And once again, that's partly because the dysregulation of the immune system have a much far-reaching effect beyond just the lung and the spleen. All right. Anyways, the general standard approach is as a patient come in and they have yin and qi deficiency of the lung and spleen, the first formula to use is one called Sa Shen Mai Dong Tang Galenia and Ophiopogonus decoction. And this is a combination of the formula. All right. And for the hospital recommendation, essentially the same, qi and yin deficiency of the lung and spleen. And this is their customized formula. But basically, you can see at the very top, you have Sa Shen and Mai Men Dong. Okay, so that's basically representative of the Sa Shen Mai Dong Tang because those are the two chief herbs. Okay, and this is the book called The Guidance for Coronavirus Disease 2019. And once again, it has a standard protocol for recovery phase. These are the signs and symptoms. And this is a customized formula that's used. Okay, so slightly different, but once again, the overall direction of the diagnosis and the treatment is the same. Basically, to treat lung and spleen, and also to nourish qi and yin. Okay, so they break it up to two separate formulas. And once again, for the qi and yin deficiency, you have Nan Sa Shen Adenovera, Bei Sa Shen Galenia, and Mai Men Dong Ophiopogon. So once again, Sa Shen, Mai Men Dong are the two main important herbs. All right, so that is what most of the long COVID patients have in common, some qi and yin deficiency of the lung and spleen. All right, so as we dive a little bit deeper, okay, so now we're going to talk about some of the more different variations or complications or patients that show more severe signs and symptoms. So one of the first one is pulmonary fibrosis. Okay, so this is not just a mild or moderate case of COVID-19 that comes and goes within a few days. These are the patients that actually show severe pulmonary fibrosis. Basically, the cells, the linings of the lung has been severely damaged. And then as a new cell grows back, a lot of it is just fibers, So obviously the fiber is not very elastic. So it doesn't expand and contract like a normal lung would. And therefore, these patients have a lot of stiffness, rigidity of the lung, and that is a significant or serious complication of COVID-19. All right. So basically, as this article goes on and talk about pulmonary fibrosis, the main diagnosis and formula that's recommended is a formula called 血府足鱼汤. So the one with a big red arrow. Okay, so 血府猪汤 means to drive out blood stasis in the mention of blood decoction. So historically, this formula is used to treat blood stagnation or blood stasis in the upper jaw for two main conditions. One is coronary artery disease, so that's blood clots in the heart, and the other is blood stasis in the lung, so that's pulmonary fibrosis or pulmonary embolism. Okay, so this is a great formula to use back then, and it's still a great formula to use today. Okay, so if you ever see patients that have either the TCM manifestations or the Western disease of blood stasis, blood clots in the upper jaw, perhaps even in the rest of the body, this is a great formula to use. Okay, basically the terminology may be a little bit different. We tend to describe the functions of the herb somewhat in an artistic term, right? So we activate blood circulation, dispel blood stasis. And in Western medicine, their terminology is these herbs have antiplatelet, anticoagulant, and perhaps even thrombolytic effect. All right. Here is another formula that have been used to treat pulmonary fibrosis. This one is more specific for pulmonary fibrosis after new crown pneumonia, basically COVID-19 induced pneumonia. Okay. And the diagnosis here from the article and their perspective is phlegm and blood stasis blocking the collaterals, along with deficiency of lung and spleen and deficiency of qi and yin. So the underlying part is the same, qi and yin deficiency in lung and spleen, but also blood stasis. All right. And this was a formula that was recommended. Most of the formula makes perfect sense. You have some herbs that tonify qi, that nourish yin, and also some herbs that eliminate blood stasis. And what's interesting is this formula did not disclose the dosage of the herbs, except the very first herb. And my experience in reading a lot of these articles is that obviously it takes a lot of funding to conduct a research. You know, in the US, it's millions and millions of dollars. In China, probably a little bit less, but it's still a significant amount of time and money. So sometimes what happened is the formula that's studied is a proprietary formula, and they want to be able to make this into a commercial product. So as they do the research, they will present all the herb, but they will not disclose the dosage, hoping to keep this as a proprietary formula. But in this case, they specifically disclose the dosage of huangqi, astragalus, and nothing else. You know, so that's quite interesting. And my rationale, my interpretation is that obviously, as the study is published, a lot of people will try to use the same approach. And the researchers want the study and the formula to work well for most of the patients that end up using this. Okay, so they do encourage the people to use it, and that's why all the herbs are listed. But at the same time, they don't want people to know this is the exact formulation. But in order to get a good effect for this formula, the researchers must feel compelled to disclose the dosage of huangqi. Meaning, if it's not used within this dosage range, it's probably not going to give the desired effect. So why is that? You know, huangqi, you know, the name of the formula is yi qi, which means to benefit qi. But if you are just going to benefit qi and use huangqi to tonify qi, usually the dose is about 6 to 9 or 6 to 12 grams. Why would you need 30 to 60 grams, right? So that's a very interesting question mark, okay? And we'll get back to that a little bit later. But for now, I just want you to keep that question in mind and remain curious, all right? In any case, you know, that was the base formula to tonify qi, nourish yin, and also dispel blood stasis in the lung. And then the variation is if the patient has excessive lung and spleen qi deficiency, these are the herbs you can add. Okay, if the patient also has insufficiency he, then sasen, maimendong, and so on are the herbs you can add. So this is somewhat of a standard TCM approach, where you start out with a traditional formula, and then depending on the signs and symptoms, you modify as necessary. All right. So that's the more severe case of lung damage due to COVID-19. Okay. Or long COVID patients. And then, of course, a lot of patients may also have cardiovascular complications as a result of COVID-19. Okay. So once again, this is an article that specifically talk about traditional Chinese medicine and COVID-19 treatments. Okay, and they list out that at the very end, the patient may also have heart and lung qi deficiency. And if that's the case, then Seng Mai San, generated pulse powder, is the best formula to use. And the main herbs in here are Rensen, ginseng, Mai Men Dong, Ophiopogonus, and Wei Zi Shisandra. Okay. This I think is perfectly fine. My only caution is don't use this if the patient is still in the heat stage. Heat stage referring the active COVID-19 infection, or if they still have the dysregulation of the immune system. And the reason is because Rensen is a strong qi tonic that also has a strong effect to boost the immune system. So if the patient already have dysregulation of the immune system or hyperactivity of the immune system, you really don't want to throw gasoline on top of the fire, So, or in this case, using a hot herb on top of a hot condition. Okay, that will just make the condition worse. All right. So this formula is to be used in the long recovery phase where they have heart and lung qi deficiency. All right. So once again, these are the TCM signs and symptoms pattern, and also the Western diagnosis that have been used for this particular formula, along with the description of TCM functions in the Western pharmacology. All right. This next one is regarding the complication of thrombosis, basically blood clot and TCM. So in this case here, in addition to the 血府足鱼汤 we mentioned earlier, depending on where the patient is having most issues with blood clotting, then different formulas can be used. So 通窍活血汤 block the orifice and invigorate the blood decoction is best for the head region. 血府足鱼汤 drive out blood stasis in the mention of blood is best for upper jaw. 阁下足鱼汤 drive out blood stasis below the diaphragm is for middle jaw. 少腹足鱼汤 drive out blood stasis in the lower abdomen decoction is for lower jaw. And then 生痛足鱼汤 is for the extremities. So head, upper jaw, middle jaw, lower jaw, and the extremities. All right. So historically, these herbs are originally designed to treat physical trauma, external injury type of problems, mostly for people that engage in martial art type of things. But then later on, they are used quite a bit for internal medicine purpose with clots and embolism and so on. And in both cases, they work equally well. Okay, and the good thing is it makes it much easier to do a differential diagnosis and know exactly which one to prescribe, because anatomy makes it very simple. Okay, and one thing, in case if you're not aware, is that obviously Chinese medicine has a lot of medicinal effect. And in fact, many of the drugs take the inspiration from Chinese medicine. And this is probably the best example. 水蛭 Hirudo is a Chinese herb that's described to break and eliminate blood stasis. And then interestingly, lepiridin is one of the compounds within 水蛭. And it has been extracted and made synthetically by the drug companies. It's both an oral medication called Hirudin and also an injectable called Reflutin. Okay, so while our terminology may be different, but in the end, they are really doing the same thing: break and eliminate blood stasis. And in Western medicine, this is an anticoagulant and antiplatelet type of drugs. Okay, just to show that medicine is medicine and patient is patient. Even though the paradigm, the description, the perspective may be a little bit different. All right. Another common complication with COVID-19 infection and also long COVID is gastrointestinal complications. Okay, so once again, this is an area where the disease may first enter and also cause a lot of damage leading to long COVID. All right, so in this case, during the convalescence, the formula of choice is 参苓白术散, or in this case, they use capsules, 参苓白术 capsule. Okay, so this is a classic formula. 参苓白术散 is a great formula to tonify the spleen and stomach qi. Okay, so historically, as patients have been bedridden for a long period of time, they become very fatigued, very tired, very deficient. During the recovery process, this is one of the best formula to use first because you need to strengthen and tonify the digestive system so the patient can actually digest and absorb all the nutrients in the food that they take. And then as their digestive system becomes stronger and stronger, then you can prescribe more herbs that the patient can actually absorb to treat other parts of their body or other problems. Okay, but you need to strengthen the digestive system first. Otherwise, any other formula you prescribe may just go in one end and come out the other end if they cannot absorb it. All right. So this is the formulation Senling by Susan. It's one of my favorite formulas to use. Okay. So once again, the TCM signs and symptoms as well as Western indications. Okay. Next one is the liver. All right. So once again, a lot of people with COVID-19 may end up with complications in organs far from the lung and the kidney, lung and the digestive system. Okay, so the next two are liver and kidney, which are two of the most important organs in our body. Liver is responsible for metabolism, and kidney is responsible for elimination. So if the liver and the kidney cannot function properly, then what happens is all the things that we take in, okay, will end up being accumulated in our body for an extended period of time. And that will then cause a lot of problems. Okay, so it is very important to ensure that the liver and the kidney functions are proper. All right. So this next article will talk about many different things. Okay, clinical aspect and impacts of traditional Chinese medicine on the convalescence of COVID-19. All right. So we look at quite a few things, but primarily the recovery from the digestive system, and the recommended formula is Senling by Susan, like we just mentioned. And also, if the patient has liver issues, okay, damage to the liver, then Xiao Cai Hu Tang is a recommended formula. And then on top of that, of course, people that show different patterns will then get personalized or customized formulas. Okay, so Xiao Cai Hu Tang is one of my favorite formulas. It's also a formula that is the most commonly used herbal formula in Japan. Okay, so for your information, for those of you who are not very familiar with the Asian culture, what happened is Asian culture is one where people are expected to follow the norm, to follow the society rules and regulations. You know, so when we are in school, we basically are taught to listen to the teacher and listen to the parents without questioning, without defiance. And then once you graduate from school and enter the society, you are also expected to behave a certain way. So usually what happens is, as you are suppressed in your individual thoughts and feelings, you need a way to vent it somehow, some way, right? So what happened is a lot of people then turn to drinking as a way to release themselves, right? So what happened is the Asian adults a lot of times never outgrew the binge drinking from the college days, you know, as in the college kids in the US. So what happened is a lot of adults that do business will drink a lot, quite a bit. And then when they get together for social reasons, when they get together for business reasons, alcohol is one of the things that they drink. But in this case, not just socially, but in a way, kind of pathologically. So they drink and they drink too much. And as a result, hepatitis, liver cirrhosis, and liver cancer become a huge problem all throughout Asia. And in fact, 3 of my uncles from my mom's side all died from liver cancer, in part because they drink too much. Okay, and my point here is liver is an organ that, you know, obviously, like I mentioned, is responsible for metabolism. So when you overload it with toxins, then at some point it's going to fail. Okay, so in Japan, it's no different. Okay, in Japan, in fact, Xiao Cai Hu Tang is the #1 most frequently prescribed herbal formula over there. And the reason, once again, is because they have the problem, like Taiwan and probably China as well, or people, especially men, that drink too much. All right, so when they have liver problem, when they have hepatitis, increased liver enzyme, liver cirrhosis, liver cancer, and so on, usually in the beginning, it shows as liver heat. Okay, because liver is under stress, liver is inflamed, and a hint is that usually when you see a Western disease that ends in itis, whether it's hepatitis, pneumonitis, cystitis, and so on. Itis means inflammation. So that means the organ is inflamed. So hepatitis, think of it simply as liver damping or liver heat, right? So in this case, you need to first start out with herbs that treat the liver heat. And as the disease progresses, the heat will then cause damage to the yin. So now you have heat above and also insufficiency underneath. And then with insufficiency, you will come with damage to the organ. You also have compromise to the function. So now you have excess and deficiency all at the same time. And this is now the patient progressing from the yang stage to the yin stage, from Taiyang and Yangming to the Shaoyang stage. And that's what Xiao Cai Hu Tang is for. All right. So this is a great formula to treat patients that have hepatitis, that have different liver conditions, and also for patients that as a disease go from the exterior to the interior. That's in the half exterior, half exterior condition. Okay, so a lot of alternating signs and symptoms, a lot of yin and yang signs and symptoms, a lot of heat, a lot of deficiency signs and symptoms. So in a way, a very complicated picture. Okay, and another way to look at this, as far as a COVID patient is concerned, is that these are probably patients that have dysregulation of the immune system that's triggered by the virus infection, right? So now the immune system is dysregulated, and it's not always hyperactive, but it's regularly becoming hyperactive. So it's going to attack many different parts of the body, in this case, probably the liver. So you have bouts of hyper immune response, you have bouts of inflammation, but at the same time, you have damage to the organ. So that's, once again, the yang and the yin and the yang and the yin fluctuation. So basically what Xiao Cai Hu Tang is able to do, if you look at the composition, is that they are herbs that release the exterior, they are herbs that nourish in, and they're also herbs that tonify qi. So through this wonderful balance of herbs that treat the entire person, that treat the whole thing, somehow is able to restore balance of exterior and interior, the yang stage and yin stage, and the hyperactive of the immune system, as well as the underlying damage. Okay, so Xiao Cai Hu Tang is quite a miraculous formula. Okay, and like I mentioned, it's able to do that because it's able to help to regulate suppress the inflammation. It has anti-inflammatory effect. It also has a immune stimulant effect, as well as immunoregulatory effect. All right. So as far as patient in this particular study, it also shows that Xiao Cai Hu Tang works quite well to bring down the key indicators of liver under stress, mainly the different liver enzymes. Okay, so Xiao Cai Hu Tang in this case definitely shows to have good protective effect on the liver for patients that are recovering from COVID-19. All right. And one last thing I want to say about this formula is that, once again, Xiao Cai Hu Tang does have ginseng as one of the ingredients. And as we mentioned earlier, ginseng is a strong herb to tonify qi, but also to boost the immune system. Okay, so for these patients, they really should be in a Shaoyang stage, where there is both excess and deficiency, yang and yin alternation. But if there is still a lot of heat, if you feel there's still a excessive hyperactivity of the immune system, then what you may choose to do is either take out ginseng if it's too hot, or maybe replace it with something that's less warm and less hot, maybe with Shiyangsen American ginseng, or with Dangsen Cotonatus. Okay. Also, if the patient has an active COVID-19 infection, once again, don't use ginseng, because once again, ginseng is too hot, and you don't want to stimulate the immune system any further during that case. All right, so save this formula for a little bit later, when there is no longer excess heat, but alternation of heat and cold, yang and yin. All right, the next complication is with renal, is with the kidneys. Okay, And this is another interesting phenomenon, and this is another interesting article. Okay, so this article specifically look at how Chinese herbal medicine may be used to treat renal injury. Okay, and this article, I think interestingly, is one that's compiled by researchers, but not by clinicians. Okay, and I'll tell you why as we go on. So basically, they look at all the patients with COVID-19 that have signs and symptoms of kidney dysfunction. And the statistic is that 59% has proteinuria, 44% with hematuria, 14% with increased blood urea nitrogen, 10% with increased serum creatinine, and 29% with acute renal injury. Okay, and then the pathological damage is there is tubular epithelial cell dysregulation, degeneration and shedding, renal interstitial congestion, and also microthrombi and focal fibrosis. So basically what that means in Chinese medicine is when you have degeneration of the cells and epithelial cells, that's in deficiency and in damage. When you have interstitial congestion, that's probably from phlegm accumulation. And then the fibrosis is a blood stasis. Okay, so these are the patients, once again, as the virus attacks the body, as immune system become dysregulated, once again, the immune system attack the kidney and damage the kidney and its functions, right? So the TCM diagnosis, once again, is degeneration of the cells is in deficiency. Congestion is when all these dead cells and so on became phlegm and block the normal pathways. And then finally, as the body recovers, it recovers in fibrosis, but not in normal healthy cells. So that's blood stasis. So these are the things to address as we come up with a formula to treat the patient from both Western and also from TCM perspective. And this is the part that I mentioned that this is more of a research done by statisticians, but not clinicians. Because what they did is they looked through all the formulas that have been used to treat patients with renal dysfunction. And they looked through 207 prescriptions. They take all the herbs and they are trying to find out what herb is the most commonly used. Okay. And what they found is quite interesting, right? Because what you would think is that the herbs should be herbs that nourish in, that increase the elimination of water, reduce the load for the kidney, nourishing, and so on. But rather, the number one most commonly used herb is Huangqi astragalus. And in fact, the percentage is quite high. 34.3% of all the formulas that treat renal injury has Huangqi in it, right? So once again, that is a big question mark. Huangqi, as we learned, is a qi tonic herb. It is used to tonify qi, boost the immune system, but nowhere in our education from a classic information perspective is it used to treat renal injury. All right, so why is that the case? Why is Huangqi used in so many herbal formulas? All right, so the question is, or the answer is, through pharmacology, it has been shown that Huangqi, when it's used at a large dose, 30, 60, or even 90 grams, in fact shows a different function compared to how it was described historically. Huangqi at a large dose, in fact, has an anti-inflammatory function or immune regulatory function, in that it reduces the renal inflammation by inhibiting the pro-inflammatory factors, such as interleukin, tumor necrosis factor, and COX-2. It also alleviates the apoptosis and necrosis of the renal cells, and then finally alleviates the renal fibrosis and inhibiting the CASP3 activation. So basically, at lower dose, at a qi tonic dose, it tonifies qi and boosts immune cells, immune functions. But a large dose, it has the, I wouldn't quite say opposite, but a different effect, where it's able to regulate the inflammatory function, regulate the immune function, to bring down the excessive or abnormal or dysregulated immune cells and immune functions, and therefore, and also the damage that they cause. Okay, so this helps to explain the earlier formula that we saw that benefit qi to treat pulmonary fibrosis, why Huangqi was used, but especially at such a large dose. And the reason, once again, is because Huangqi astragalus at low dose tonifies qi, but at a much larger dose, once again, 30, 60 to 90 grams, becomes an herb that regulates the heat, that balances the heat. All right. But, well, not but in addition, if you have other more standard renal dysfunction, which is maybe edema, maybe the kidney is not able to get rid of the excess accumulation of fluid or other things, then these are the standard formula you can use to improve the function, such as 五苓散 or 五皮饮, or to restore the form, to tonify yin, such as 六味地黄丸, 金匮肾气丸, and so on. So once again, the form and function, anatomy and physiology are all tied together. So in this case, the first formula are to get rid of water. So that's for the function. The last few formulas are to tonify the organ. So that's for the organ itself. So once again, function and form, they're all tied together. So in this case, you may need to use both formulas together. Okay. And the last part, as far as complications go, is with the nervous system. Okay. So that includes both the central nervous system and also the peripheral nervous system. And these are some of the complications that we do see quite often from COVID-19 that I have not presented in the past. Okay. And this is probably also one area that I get from practitioners quite often and still do to this day. And that is, if the patient comes in and they have altered or loss of smell and taste, a lot of practitioners all of a sudden doesn't know what to do. Because as far as I know, this is not mentioned in any of the classic literature where the patient has loss of smell and taste. So a lot of practitioners then become like deer in front of headlight. They don't know what to do. But if you think through it, if you read through the pathology, it actually becomes quite obvious. All right. So the general statistic is that 13% will have some type of a total loss, well, 13% will have total loss of smell and taste in post-COVID patients, 44% have partial loss. So quite a bit. A lot of them are affected with the nerve function as a result of COVID-19. And like I mentioned earlier, if you think through the pathology, then it becomes quite obvious. And the pathology is that as the coronavirus affects the body, okay, what happened is it attaches itself to the ACE2 receptors to enter the cell and damage the body. But what happened is the nervous system does not have a ACE2 receptors. So the COVID-19 virus really does not directly attack the nervous system. But what happened is next to the, let me see if my mouse works. Okay. So next to the nerve, which is this yellow picture here, next to the nerve, you have the tissues, okay, that do contain ACE2 receptors. So what happened is the virus attacks the tissues that surround the nerve. And then as those tissues become affected, inflamed, and expand in size due to inflammation, it overreaches to the nerve cell, affect the nerve cell, perhaps cut off the circulation of blood and nutrients and oxygen and so on. And as the nerve cell become affected secondarily, they become affected and they begin to lose part of their functions. And that is why patients with COVID-19 or post-COVID-19 end up with altered smell and taste. Okay, so what you really need to do is if you can reduce the inflammation of the surrounding tissues, allow the blood to once again flow back to the nerve and allow the nerve to have adequate space to function, then generally speaking, the loss of function will then be restored. Okay, so the key here is to make that diagnosis early, to treat it early. Because if you wait for too long, once the nerve cell eventually gets damaged irreversibly or dies, then perhaps the loss will then become permanent. All right, so ideally, if the patient complains of altered or affected function of smell and taste, you treat it as early as you can by treating the inflammation, treating the heat, and perhaps even opening, using blood-moving herb to increase blood circulation. And those are the best ways to approach how to treat anosmia and ageusia, which is loss of or affected smell and taste functions. All right, so in the early stage, if there is still infection, you can use 普剂消毒饮, which is to treat infection. If it's a little bit later where the infection is gone, but there's still a lot of inflammation and congestion, then you can use 薰衣散 magnolia flower powder, 苍耳紫伞 gentian powder, or 青皮汤. And if the infection is gone, the inflammation is gone, but now you have the leftover, which is a blood stasis that's blocking, that's causing the blood nerve cells to die, then you need to use 通窍活血汤 to unblock the orifice and invigorate the blood circulation to get the blood circulating back to the disease area and hoping that the body will heal itself. All right. Another very complaint, and once again, this is an area where TCM practitioner literally have a brain fog and don't know what to do. And this is a cognitive impairment. So this is a very generic and general term that basically refers to slow or sluggish thinking. And it can occur under many different circumstances. Okay, and it's very hard to describe for the patient that have it. They can definitely tell you they have it. You know, basically their body, physical function feels the same, but their mind, their mental acuity, sharpness is just not the same. All right, so statistic is that 20 to 32% of the patient that suffer, 20 to 32% of the post-COVID patients suffer from some level of brain fog. And once again, in this case, the etiology is that the virus does not attack the brain because the nerve cell does not have ACE2 receptors, but rather it's through the virus causing chronic inflammation, perhaps causing blood clots, perhaps damaging the blood vessel or damaging the blood-brain barrier, leading to lack of oxygen, lack of blood, lack of nutrients to the brain that then cause the brain fog. In fact, I had one patient that had brain fog and also dysmenorrhea at the same time. And that patient took formulas to move the blood to treat dysmenorrhea and also commented that her brain fog got a lot better. Okay, so once again, depending on when you see the patient, improving blood circulation, reducing inflammation are two very important aspects of treating brain fog, just like treating anosmia and ageusia. And if at the end, the infection is gone, the inflammation is gone, but they still feel their mind is not very sharp, then there's a classic formula that's been used with good success, and it's called 益气通明汤, augment the qi and increase purity decoction. This is a classic formula, but unfortunately has not been used a lot in the past. So chances are you are not going to find this as a commercial formula you can just purchase and give to the patient. But rather, if you want to use this formula, you will have to get the ingredients and then make up the formula on your own. Okay, but formula is pretty simple. There's no secret ingredient. Basically, overall, is to tonify qi, to nourish yin, and also to, to some extent, clear deficiency heat. Okay, so overall, it's a great formula to help to improve the mental acuity. All right. And then in addition to the herbs, these are some of the acupuncture points you can use, and then help teach the patient how to do their own acupressure and massage, and also the ear as well. And like I mentioned earlier, in addition to acupuncture and Chinese herb, exercise is also very important. So two that have been used the most is either 八段锦, which is the 8 brocade, and also 太极拳. Okay, both of them are perfectly fine. Personally, I think in the beginning, especially if they don't feel like they have good balance, then 八段锦, 8 brocade is better, because this one generally you're doing it in a more stationary stance, so you don't need a lot of balance, and also it's a lot easier to learn. Okay, 太极拳 requires a little bit more balance. It's a little bit more complicated. So anyway, if you are interested to teach your patient, you can click on the link. It will take you to a video that shows you exactly what exercise to do. Okay. In fact, there have also been clinical studies that show that these rehab exercise and acupressure are in fact very beneficial for the recovery. Okay, so once again, these are additional information about videos and where you can go to acupressure points that the patient can safely do at home. Okay, and these are the comparison of baseline and also after 1 month of exercise and acupressure. Okay, so overall, Zhang Boli, by the way, is the leading authority in China that helped to guide the prevention, treatment, and recovery of COVID-19. So what he has said is that we need to focus on prevention, treatment, and also recovery. We need to focus on physical and physiological concern and treat all organs in the body, however they were affected. And then for patients that have moderate to severe COVID and long COVID, it may take up to 1 year for full recovery. All right, so make sure we are persistent and continue with all efforts. Otherwise, they may not have full recovery. And this last part here, we'll quickly talk about the COVID-19 vaccinations because, like I mentioned, the COVID-19 is trending down with each variation of the virus. It's becoming more and more contagious, perhaps, but less and less lethal. So I think at some point in time, almost all people will have gotten COVID-19 and hopefully get over it and have natural immunity. But what happened is just as many people have gotten the vaccine, and here are some of the issues to keep in mind. These are the more standard reactions, whether it's local reactions due to injection or more systemic reactions. So these are at least something that's fairly common that we know and can expect. But what's less known and is starting to surface more and more is that with the injection of the virus and all the things that are in the injection, what happened is for a minority of the patients, it triggers the immune system to become hyperactive and dysregulated. And that then leads, as this graph shows to the bottom right, to autoimmunity. And what that means is the patients start to show autoimmune disease, where the immune system becomes dysregulated and start to attack different parts of the body and cause different type of autoimmune disease. So this is an article that talks about autoimmune skin reaction following COVID-19 vaccination. This one talks about Stevens-Johnson syndrome after COVID-19 vaccination. This one talks about Guillain-Barré syndrome, once again, after vaccination, and so on and so forth. Okay, so I also did a autoimmune seminar a few years ago, and basically think of it this way, as the world and all the things that we come in contact with show or have more and more non-natural substance. What happens is as we accumulate more and more of this in our body, the immune cells don't recognize it, and as a result, try to attack it and sometimes go overboard. And then that going overboard is what triggers the autoimmune disease. So that is the same with the vaccination in the case. All right, so it doesn't happen in a large number of patients, but it happens in enough patients that we should keep in mind. Okay, it may not be right away, it may be sometime later. Okay, so when you do see patients that start to show autoimmune type of reaction where they don't have these disease before, one of the possibility is it could be a reaction from the COVID vaccinations. And this is something that takes more than an hour to talk about. But basically, like I mentioned, if you really want to learn the topic, please go back and watch the webinar that I did on autoimmune disease. But in essence, what happened is this pathology is very similar to the wound being pathology in TCM, where you start out from exterior condition, from Wei, which is immune, Qi, which is energy, Ying, which is nutritive, and Xue, which is your blood, going from the exterior to the interior. And as the disease goes more and more interior, it becomes more and more serious. Okay, so what we, in essence, need to do is we need to clear the systemic heat and fire, which is your hyperactive immune system. We need to nourish the yin, which is to restore the organ damage that's caused by the hyperactive immune system. We need to treat the blood stasis if there's any, which is the fibrosis, and then improve the functions of the organ that's been damaged, which is the bona fide qi. So basically, as a disease moves from exterior to the interior, as we treat these patients, we need to go from the interior and slowly move the disease to the exterior and eventually out of the system. Okay, so this is something that can be done but it takes a while, and it's also quite complicated because the diagnosis is different at different stages, and treatment is also different at different stages. Okay. Another complication of COVID vaccine that are starting to show is COVID-19 vaccination in patients that have cancer. Okay, obviously the standard recommendation by CDC and most of the Western hospital is everybody should get vaccinated, including the cancer patients. So that is what the standard recommendation is from the Western medicine. But what we are starting to see, and finally, most of the media is starting to allow some discussion and some debate, where in the first few years, that was completely prohibited. So as more information come to light, we can begin to see things a little bit better. And I think this phenomenon is like blind man trying to feel the elephant and describing what the elephant is like. So in the beginning, we don't see it clearly. We see it only see it part of it. It takes a while to step back and look at the big picture before you can see the whole thing. And I think with COVID-19 treatment, that is also the same way. As time goes by, we can see what are the effects, what are the side effects of all different treatments, whether it's Chinese medicine, Western medicine, or vaccination. So in this case, some questions have been raised as to what the side effects are with COVID vaccination. And I would just sum it up in something that's relatively simple, in simple terms. And that is, COVID-19 was originally approved to treat the earlier variants of COVID virus. So alpha, beta, all the way to delta. And what happened is the original vaccines were geared to that, but now the virus has mutated quite a bit. And the ones that we see most are Omicron variants. Okay, so what happened is a lot of the COVID boosters are still being given. And what then is happening is these booster shots are given to patients, and the patient then respond by increasing the production of spike proteins, mostly in the earlier variants. Okay, but those earlier variants are no longer in circulation. But what happened now is the patient's immune system, with every booster shot, becomes exhausted. It produces more and more of spike protein for the earlier variations, which don't exist. So basically, you are protecting against earlier strain that's no longer there. And at the same time, your immune system becomes exhausted because it's working too hard. And as a result, when the Omicron version comes along, they have different spike protein presentation. Therefore, the booster shots do not protect against the Omicron. And as a result, a lot of people that are vaccinated and boosted, in fact, catch the Omicron more easily. Okay. And then what also happened is that as the immune system geared too much toward producing the spike protein and the humoral immunity, it leaves the T cell immunity more vulnerable and also not as much. And as a result, the cancer cell have a higher chance to grow. Another thing also is the spike protein, as you show here in the middle, obliviates 90% of the DNA repair mechanism in lymphocytes, and lymphocytes are needed to fight cancer cells. Okay, so what happened is, as these booster vaccinations cause the body to produce more and more spike proteins, that in turn cause the body to be less able to defend against cancer. And that's why, if you see under the last point here, that people that get repeated booster shots may have a regrowth or return of the more aggressive metastatic cancers. All right. So what's happening at this point in time is a lot of patients are seeing that, a lot of oncologists are seeing that, more than anecdotal. Okay. So again, we are seeing the tip of the iceberg. Okay. So where will this lead us? We don't quite know at this point in time. but I'm not trying to tell you whether a person with cancer should or should not get COVID-19 vaccination or booster shots. But rather, I think we are starting to have a more healthy debate of the information and also the data, so we can then talk and discuss and make a better and more informed decision as to what is the best way to prevent, treat, and also to recover. All right. So I think, even though I think this is my last presentation with COVID-19, I'll leave that door open. If more information, in fact, become available, then obviously I'll do more presentation. So we'll leave it at that point. But one thing is for sure, okay, historically, there used to be a very little information with Chinese medicine and research that are published online. But I think with COVID-19, that is now completely changed. If you go online and go to PubMed.gov, which is basically a Medline source, and type in COVID-19 and traditional Chinese medicine, you in fact end up with 1,866 results. So in other words, there are 1,866 peer review clinical, well, not necessarily peer review, 100 journals, medical journals that are published online that we can easily get. Okay, so this is quite a big change compared to pre-COVID. Pre-COVID, there were little information with Chinese medicine and pharmacological research and clinical research. So I think that is a great movement ahead because the rule of the game in the US or in the Western world is clinical research. Without clinical research, it's hard to be taken seriously by Western medicine. Okay, and one of the clinical research that's wrapping up and probably will be published later, well, in the early part of this year, is a clinical research done by UCLA and UC San Diego on use of Chinese herbal formula called Qinghui Paitu Tang, specifically to treat COVID-19. Okay, so I work with UCLA and UCSD in early parts of 2020, and it has taken just about 3 years to complete the study. And they are now analyzing all the data. They're going to submit it to medical journals, and they are hoping to have it published by March or so. So when it's published, then what I will do is I will invite the principal investigator from UCLA and to do a webinar, basically to share all their findings with the entire TCM community. So keep your eyes and ears open for that. And in the meantime, a introductory teaser was published by JAMA, which is Journal of American Medical Association, to talk about this. So that's, I think, quite an impressive feat, right? To have Chinese herbs published in one of the two main Western medical journals. Obviously, one is Journal and the other one is New England Journal of Medicine. One is JAMA and the other one is New England Journal of Medicine. Okay, so they had a quick article, 2-page, describe the mushrooms and how they can be used, and also the Chinese herbs, which is in this case is Qinghui Baitu Tang. And I was also quoted to quickly describe what the function of Qinghui Baitu Tang is, as far as how they are used to treat COVID-19. So I think this is a great step forward for Chinese medicine, and we can all take celebration in that. All right. And this is what the part that that was quoted in the JAMA article. All right. So that's my presentation for today. Okay. If you have any questions, feel free to put it in the chat room. Okay. And I'll answer a few questions. And we are already over time. But if I don't get to your question, then send me an email directly, and I'll be more than happy to reply to you. Or, well, actually, this is better. I will reply to all those questions, and I'll give it to Donna. And then Donna will find a way to get it to all of you. So then all of you can see the question and see the reply at the same time. Okay, let's see. Okay, there are quite a few comments and questions. That's good. Okay, I'll try to answer some questions that are more general and that will help with most people. Okay. One of the question is, I see a lot of cold symptoms with long COVID instead of heat symptoms. Inability to get warm, feeling of cold deep inside the bones, pain that is better with heat, and so on. Okay, so one of the most different paradigm with Western medicine and Chinese medicine is Western medicine treats a disease, and Chinese medicine treats a person that has a disease. So oftentimes what happens is, with Western medicine, diagnosis is very specific. Treatment is sometimes not as effective because different people that have the disease will show different signs and symptoms. Also, the same disease at different point, at different time, also will also be different. So if you see COVID patients, if you see long COVID patients, the best recommendation I give you is don't treat the Western label, don't treat the Western diagnosis, but rather evaluate the signs and symptoms, look at the tongue, take the pulse, and then treat the person that has the disease. Okay, and if you do that, following the person, following their signs and symptoms, and choose different formula, make up a personal formula, that is the best way to get the best results, and I feel like I'm a broken record, and I repeat this all the time in all the phone conversations, with patients. I'm with practitioners. They will often say, well, my patient has this disease or that disease. Basically, that's what the Western medical doctor tell the patient, and then the patient tell the practitioner, and then the practitioner, once again, is a deer in front of headlight. Oh, I didn't study about this disease in school. I don't know what to do. But rather, if you just take a step back and look at the whole picture and utilize your TCM training, that is the best way to practice traditional Chinese medicine the way we were trained. Okay, what is a large dose of Huang Qi? Like I mentioned, it's 30 to 60, maybe even higher. And that is, once again, not to tonify Qi, but rather to control the dysregulation of the immune system and also the hyperactive immune system causing damage. Okay, I think I'll end here. Like I said, I think a more effective way is for me to gather all these questions, and I'll answer them on a separate file, and we'll distribute those files to you. So I'll make sure I get to all the questions. So I want to make sure, Donna said we're able to save these chat and all these questions, right? Okay. Okay, sounds good. Sounds good. So we'll do that. Okay. That way we can get to all the questions, and everybody can see all the questions and all the replies. All right. So once again, thank you very much for coming to today's webinar. We will for sure have one more, and that one more webinar on COVID will be when UCLA and UC San Diego finish with their clinical study and the study published. That will be for sure be one more. And like I mentioned, if for some reason COVID-19 virus happened to take another turn, or treatment happened to take another turn, if there is sufficient information to worthy of another seminar, then I'll do another seminar. Basically, I will continue to follow this so we can all share the same information. All right. So thank you very much. And once again, have a great Happy New Year.
Thank you very much, everyone. And thank you, Dr. Chen, for your generosity, for sharing all of your knowledge and taking the time to teach us all today. For our attendees, if you enjoyed today's class, we'd appreciate it if you could share your thoughts on social media to help promote both our speaker, Dr. Chen, and eLotus. Thank you again for joining us today, you guys, and we hope to see you at our next CEU webinar on January 11th. Fatigue and Fibromyalgia, Dr. Jimmy Ching's Herbal Master Sheet, in which participants will be guided through various differential diagnoses for fatigue and fibromyalgia that is commonly seen in clinical practice, with the addition of clinically successful herbal formulations for each condition. And as a New Year's gift from eLotus, this will be a free webinar with 2 CEUs included for free also. So head on over to eLotus.org to sign up as space is limited. Again, that website address is www.elotus.org. Bye, everyone. Have a great rest of your day.